I think what sets this place apart is the atmosphere of care that is warm and compassionate, from the nursing staff that just does a fabulous job working with the families, to the doctors, to the ancillary care people and the individuals that take care of the patients when they get home. We have a group of people that also follow up with the patients and making sure that they not only get good care while they're here in the hospital, but also good follow-up care on an outpatient basis. I'm especially proud of the culture, and I think what sets us apart is the warmth and compassion of the caring that's here. Not only is it high quality care and very, very safe care, but I think the warm, friendly touch that you get here in the local community is second to none. Most of the families that do leave the community and see other institutions find out just how wonderful and how warm the care is here and love getting cared for here. We have quite a gamut of subspecialists here, so it ranges from the very beginning, the neonatal intensive care doctors, those doctors that take care of the smallest babies that we have, the ultra preemies, all the way up to the young adult doctors that take care of our trauma patients in the pediatric intensive care unit. We range from pediatric infectious disease, pediatric hematology, oncology, the patients that are cared for cancer. We have doctors that are specialized in trauma care, pediatric pulmonary care, lung care for the patients that have lung problems. We have pediatric urologists, those that take care of the kidneys and the bladder and neurologic problems. We have pediatric neurologists that take care of the patients with spina bifida and seizures. We have pediatric infectious disease doctors, pediatric endocrinologists, pediatric orthopedists. We have a full gamut of pediatric nephrologists, the kidney doctors. We also have pediatric hospitalists that once your child is admitted to our hospital, we have pediatricians who are specifically trained in hospital medicine to take care of them while they're in the hospital. They're general pediatricians with special expertise in taking care of them while they're in the hospital. So we have the full gamut of pediatric subspecialists here at Mercy Children's Hospital. Yeah, I think we have a real gem right here in the community, and if you have a special needs child or a child who's got a need for hospitalization for anything more than an acute illness, I think the families really appreciate the fact that they're being cared for with high quality care in a compassionate way right here in the community. We have all of the subspecialties that we need, and without having to drive 2-3 hours away from here, you can receive all that care. We're hooked into national protocols for certain types of care, so that just because you're maybe out of state doesn't mean you're going to be getting any different care in terms of some of the protocols, because being a participant in the Children's Network, we have access to all of those. So it's nice for the community to be able to have their children cared for right here in a very, very high quality fashion. So it's very important, I think, for the community to support ventures such as Children's Hospital here at Mercy Children's Hospitals, so that we can continue to provide that care in a high quality and compassionate manner.